Hello, everyone. Welcome to our discussion on Data Delight, Empowering Healthcare Employees with Managed Technology. I'm Alex Gorel, your moderator for today's session, and I'm thrilled to have each of you joining us. Throughout this exclusive webinar, you'll discover how to tackle the most pressing challenges with this great topic. Before we get started, a few quick housekeeping notes. If you have any questions during the presentation, please feel free to drop them in the Q&A, and we'll address that at the end of the session. We'll be sharing a special offer to all attendees. You'll receive a copy of the slides and access to the recording. As many of you already are aware, Synoptic delivers accelerated business results through systems integration and managed services for mid-enterprise. We deliver full lifecycle technology consulting, implementation, and managed services for both application layer and infrastructure layer solutions, supported by the Synoptic platform that delivers consistent reporting, service levels, and an integrated experience across offerings. We are a leading cloud platform managed services provider and have strong alliances and partnerships. Now, without further ado, I'd like to introduce our speakers. Amy Eves, Client Portfolio Executive, Healthcare and Life Sciences. Shail Rothi, Practice Director, Data Insights and AI. And Darren White, Practice Director, Cloud and Agile Infrastructure. I invite Amy to get us started.
Thank you, Alex, and welcome everyone. Thank you for joining. This is Synoptic's first really focused healthcare webinar that we're putting on. And as we go through the topic today, which I'm going to transition to in a second, I'd love for all of you to think about the future topics that are really top of mind for you to hear about as we build out the next series of our webinars. So today's webinar is all about learning what managed technology services or digital transformation we can use to empower employees in healthcare. Empowering employees means giving them the tools to make it easier for them to do the work that they went to school for, which is caring for patients. Let's take a few minutes to understand some of the factors that are influencing labor shortage projections, which are in turn impacting the quality of work and the quality of life that employees within healthcare are experiencing in their jobs. The first part of the challenge is the attrition rates. This isn't new news. You've been hearing about this since the pandemic, but what might be new to you are the numbers. From the beginning of 2020 through 2027, approximately 900,000 nurses are projected to exit the industry in the US. This means that 1 in 5 of the nation's 4.5 million registered nurses plan to leave. Some reasons behind this include stress and burnout, or just the ability to find more fulfilling work. The bottom line is that we have valuable clinicians leaving the industry, and this doesn't impact only nurses. 2 in 3 of physicians express experiencing burnout as well. Those of us that operate in this industry need to plan ways to solve this problem. The next factor influencing projected labor shortages is the increase in the number of patients needing care. The number of Americans aged 65 and older is projected to increase from 58 million a couple years ago to 82 million in 2050. So this means that the 65 and older, the age group of our share of the total population is projected to increase from 17% to 23%, 6 points increase. That means we have to figure out how we take care of all of these patients in their elderly years. And one area we've seen grow because of this is palliative care. Palliative care is specialized medical care for people living with serious illnesses, focuses on providing relief from symptoms and stress related to the illness and aiming to improve the quality of life for both patients and their families. 83% of our hospitals in the US have palliative care programs, and we expect these programs to expand into long-term care and community practices. So it means we as the healthcare industry professionals need to figure out how to enable those programs and enable those programs with potentially, less clinicians, less people to actually run them. Hospice alone is set to grow on an 8% calculated annual growth rate year over year to a $65 billion market in 2030. So our healthcare providers need to be able to see more patients with less staff, which means we have to look for ways to leverage technology to create efficiencies and improve productivity. The last pillar of area that is contributing to labor shortages in our industry is the prevalence of mental health issues. It's a really great thing that mental health illness is now understood as an illness, a disease that needs to be treated. And it means that 1 in 5 adults are actually seeking treatment to address mental health issues. The Department of Health and Human Services, the Center for Medicare and Medicaid Services, has rolled out several programs post the pandemic to address the fact that we need to focus on mental health care along with physical health care. And they've implemented those programs to foster that. So for those of us who focus in long-term care, rehabilitative medicine, and even primary care, we need to be able to address the needs of patients that experience mental health issues too. Based on all these factors, we have an estimated shortage of up to 3.2 million healthcare workers within this decade. Now that we understand the challenge, so why is it so important for us as technology professionals to make it easier for healthcare employees and clinicians in the hospital setting, in long-term care setting, and community hospitals to do their jobs more efficiently and spend more time with patients? Data Delight, empowering employees with managed technology, is all about sharing the way that we, the team at Synoptic, have worked to make healthcare employees' jobs easier, give them more time to spend with patients instead of rekeying the same data in a different software platform. We'll talk about making the technical integrations work so the right data are available at the right time. We'll show dashboards meant to alleviate long hours of manually comparing case notes. And we'll provide an example of how AI can reduce time to generate healthcare worker schedules. And with that, I'll turn it over to Shail Rathi to take us through our first case study.
Thank you, Amy. So here I'm going to talk about a case study that is a data warehouse platform that we have built for a nonprofit behavioral health organization working on the child and the family services. The organization focuses on the programs like the foster care, adoptions, and psychological testing, as well as that of in-home services, the mobile crisis outreach. And they had a business need and a vision to create an integrated data platform, have a centralized reporting to eliminate all sort of manual data preparation and get some kind of actionable insights in time for each of the roles. With that need in the mind, they were also looking for solving the challenges that they were facing across their organization. The topmost challenge that they faced was adoption of a reporting tool, which is there were several silo groups using different type of the reporting tools. And in some cases, this was very fundamental, like using Excels. The other important aspect that they wanted to chase out was some of the pivotal KPIs, which is critical to the organization's performance, and that was about the service productivity. The third one was the siloed reporting across the groups, and the fourth one was the data integrity and the accessibility. So all of this need to be addressed along with the vision that they had about the integrated data platform. The sources that we tapped into was the EHR source, NetSmart, and the HRMS, which is the Paycom initially, and then they moved into Ceridian. There are a couple of other sources that we integrated as we walked the journey along with them over the period of 7 years. So we began in 2018, and we have been working with them as a managed service and analytics partner throughout this 7 years. I am proud to share the 7-year journey and talk through some of the business outcomes that we were able to achieve. To start with, we had to develop a data strategy, do the current assessment of the user base, as well as the challenges that they had and the data issues that they had, along with the wish list, of course. The first task was to align their data strategy to their business outcomes. And the 3 important aspects of the business outcomes that they were looking for was the performance-based contracting, the value-based care, and streamlined reporting. So with that in the mind, we embarked this journey with a CWR approach, which is the crawl, walk, and run. This was critical because the user base was very wide. We are talking about 500 plus users all across. So we did a pilot dashboard for the direct care role as well as the supervisor role, starting with. This was a minimal footprint entry into the world of integration. With the Excel as the source initially, what was more important for us was to build up the visualization layer and deliver it to the pilot group. So a 25 team, a 25 people set was being selected as a cohort for this pilot, and we delivered them the dashboard with the bare minimum immediate required KPIs. The pilot program ran for almost 8 weeks, and this was being done initially for the direct care, and then over the time, it was also being done for that of the supervisor roles. Now, with their performance data at their end and being able to review it, there was huge, significant improvement into the KPIs that they were looking. And that was the time when we actually started developing their foundational architecture onto that of Azure Cloud. This was using all the components and having the daily syncs and nightly syncs from the sources. So before we ventured into building a full-blown platform, we vetted out that the tool was right for the large user base and that they were able to get the benefit of the actionable insights out of it. As we can see into this particular dashboard, we have been able to achieve a remarkable increase into their service delivery percentages, which was around 58% as we started, and it has today been 85%. Now, this was possible because of just-in-time dashboards, the various slicing and dicing mechanism available where the time was one of the factors, but also trying to focus onto the staff-wise productivity. As we moved on to year 2, the next important KPI for such organization is timeliness. How much time do they take, the direct care takes to write the progress notes? When we started this, there was roughly an average of 12 days that the programs used to take to write and complete the notes. And this had both the fiscal as well as the compliance impact. So we extended the dashboards, which would talk about the various areas, the status, and how many of them are within the threshold, which was 4 at that point in time versus the ones which are outside of the threshold. This is how we were able to remarkably reduce the timeliness to 4 days, which was within the organizational threshold. Now, as we moved further, we also then started extending the platform to the other roles, which is the leadership role. And what would they need is a sneak preview into all the aspects of the KPIs. And that's the kind of the dashboard that we delivered, where we would have the service delivery, the average timeliness cards, also by that of the various time scale that we would be able to deliver the same measures. The caseload was also being represented over here. Now, with this all being set, there was time now to provide them the extended functionalities. And that was being done by providing them the caseload, the patient demographic, the length of the stay, the last date of the service. So these were important measures that were being added to the dashboards. Over and above this, there was one important area which was being added, and that was to encourage the high performance. At the end of the day, the staff will be able to deliver the better if they are able to get hands-on to the data and are able to perform better. So P4P is one of the programs where there is a pay for the performance. So the high performers were given some kind of incentive based on their service productivity percentages. Year 3, we moved on and started working on other important aspects of the agency's work. And those were the compliance dashboard related to pediatric symptoms checklist, child and adolescent needs, and as well as the special incident report need. All of these programs need a close monitoring of the documentation which is to be submitted and adherence to the standards laid out by that of the agency. Now, it is critical for the staff and the supervisors to understand what documents are being administered in time, outside of the range, submitted, missing, or upcoming. And this dashboards enabled them to closely take care of the load that they were having. This helped the organization uplift their compliance rate from that of 57% to 86%. So all that you wanted to chase has to be measured and shown on the various dashboards. Moving on to the next year, which is the year 4, we extended the various sources that we implemented and integrated into the data warehouse. The idea was to now look into the other areas where we have some kind of manual reporting happening. So we started with the special incident report being integrated with the DMH source as well as the ERMHS source. There were other compliance dashboards which we required for the evidence-based practices, for the full service partnership, for the short-term residential programs. And then now was the time to bring in another functional unit of the agency into that of the data platform, and that was the finance. We integrated their power plan and financial aid system to bring in the profit or the loss versus the budget, the cost of the service, and the DMH utilization, which are critical measures for any agency to measure their performances. One of the other areas was about the Quality Cup, and that was a program within the agency to encourage the continuous improvement and to foster the initiative about continuously upgrading the quality services to their end users. So this was a program where there was a 13-point evaluation, and based on those evaluation, the Quality Cup was being awarded to a program and the individual or the groups. The entire program was manual, and this took almost 300 plus hours to do, and of course, more than 2 months. This was completely automated, and this was available on demand, and we could reduce this to a 0 manual effort. And this empowered their team to frequently weigh this and provide this information. We also talked about the evidence-based practices, and this was the dashboard that we have put together for that particular program. Moving on next, we have year 5, and now was the time for us to work on some of the intricate aspects for the agency, and those are related to various grants. The agency had into their vision the desire to get the SEMSA grant. And for that, we built a couple of dashboards which enabled them to put on the matrices required for the submission throughout the procedure to get the SEMSA grant. This was also related to the norms, which is the national outcome measures, which is a part of the SEMSA grant. Now, this enabled them to quickly check through the funnel, which is part of the program, where you have various steps to be taken care of as you get the admissions into that of the SEMSA program. All of this was available onto the dashboards to their core team, and that enabled them to closely monitor and track the documentation as well as the compliance aspects of the SEMSA program. While we are walking through all of this, it's also important simultaneously to keep upgrading their technology. And so we had implemented Intune as a part to ensure that there is a robust security around all the organizational assets. As we moved on further in year 6, now there was time also to expand the availability of the data and the data warehouse to their citizen-powered users. And that's where we had lots of development area and training across to enable them to do their own reports and not rely on any of the departments and be able to research on the topics directly from that of the EHR system. Along with this, we now ventured into another functional unit, which is the HR and the payroll aspects of it. So we have built the dashboards for the requisition report, which enabled them track the entire process and reduce the requisition cycle, as well as the position control to ensure there is the optimum resource planning and alignment to the various locations, as well as that of the programs. Along with this, a third-party integration with a SaaS based software for the mobile outreach team, and that was the Chorus system integration. So they were dashboards for the mobile crisis outreach team, as well as that for the response team. Moving on further, as we moved into the year 7, now we have expanded to some of the other intricate areas like the claim report in the finance, as well as the mobile crisis response team. These 2 areas were critical to them to ensure that the claim cycle and the patient admission cycles are being reduced. So referral dashboards around the long process of vetting out the leads that had been provided by the various agency was being put together. Again, third-party integration for the FFA program, which is the Family Foster Care Adoption Program, was being done with that of the extended reach integration. Now, all of this has been going on for 7 years. We have been expanding our base, not only in terms of the programs, roles, but also in terms of the various functional units. With all of this, I would like to sum up the various business values that we were able to deliver to them over these years. So we have enabled close to 500 plus users onto that of the platform with the intuitive visualization tool, roughly around 400 direct care accessing the system day in, day out. And this staff is serving close to 35,000 patients in 22 locations, which is a huge user base to cater to. The entire culture of the organization changed towards the data-driven conversations, which is the dialogues went from let me send you the Excel to let's review the dashboards and to get the desired outcomes. We were also able to achieve an accelerated revenue cycle with the productivity rates being closely monitored. And of course, there was a huge improvement into the operational efficiency, directly leading to a better customer service with lots of manual efforts being removed and lots of automation being added. With that, I will hand it over to Darren to talk about the other aspects.
Thank you, Shell. The client case study Shell was referencing really focused on the data warehouse and business intelligence, but we also deployed additional projects to transform the healthcare organization. This has included a cloud assessment and migration, Intune to manage the end devices, and securing the end user access. The primary goal was to improve data accessibility, enhance security, ensure compliance in healthcare regulations. So as part of the cloud assessment and migration, Synoptic is considered one of 61 global Azure expert MSPs. So we have a proven methodology and framework that we like to leverage with all of our clients. We do a detailed discovery, dependency mapping that determines which applications are talking to which ones. We group them together. We coordinate with the application teams. We do the cutover and minimize the downtime for those applications. In addition, there's Intune. From a security standpoint, think of you as a new employee. You might get a new laptop, a workstation, a mobile phone, etc. It can manage all those endpoint devices and secure and set up security policies to ensure that none of that data is lost. So you can set up controls that if you don't want one of your end users going to a personal OneDrive, Gmail account, etc., you can really control all of that health information and make sure that it's secure from an audit and compliance standpoint. And then lastly, we had the end user access. So they have multiple ways to control the identities. It used to be Azure AD, now it's called Entra ID, and that's Active Directory. And so now you can consolidate those credentials. And if you're familiar with a single sign-on solution, it basically aggregates all of your username and passwords into one. It allows you to kind of spider web out to all of those, so you don't have to manage 80 username and passwords. And then there's another thing called multi-factor authentication, MFA. If you're used to logging into a system, you get a text or an email prompt with a code. It really authenticates you as an end user real time to know that your identity hasn't been compromised and you can ensure the safety of the data. And those were the other solutions that we also deployed for this client to make sure that we're taking a holistic view of the overall ecosystem to ensure that from a compliance standpoint and data integrity, we're looking at the big picture. And as part of that big picture, I think that is a challenge that we have as an industry, is to be able to kind of pan out and really take a look at what is involved in the overall landscape of the environment and all of the requirements. Because a lot of the departments are very siloed, and sometimes you got to just elevate the ask and all of the requirements and make sure that you're looking at the big pictures. Where are your remote users coming from? How is the data structured, the data management? That is where the money is for every organization. The applications mean nothing without the data. So how do you protect that and make sure that it's secure and who has access to it? Sometimes I'd say we go a little bit overboard on that, but that's where I think at the beginning you have to determine who needs access to what, and then how can we audit from a compliance standpoint. And then really looking at it from the data management standpoint, I'll give you a prime example. In a previous life, I was part of a project where we were building a large entertainment type facility. So they were going to have sports events, concerts, Disney on Ice, etc. And as a part of the art of the possible, we were trying to define that customer experience as they came to the arena. And everyone wanted everything under the sun, but they had a construction management company really trying to deploy the technology. So we're going to have retail shops, they're going to have point of sale, and they're just going to deploy whatever. However, they didn't take a look at when the end user came to the stadium, how were they going to access the information? First of all, they're going to have to park. They had problems with their parking passes. They were all paper. Everyone was using them. They would over exceed their capacity in their parking garages. They wanted to minimize that. So if you transferred tickets, so now they needed a mobile app. They needed digital ticketing. They wanted then to really look at how frequently someone comes to their events and how can they target market them. So all of that came into one picture. With all this data being siloed, they couldn't view that and they couldn't do the outreach to improve the overall customer experience. So I think that is the goal here, is really how do we make it as frictionless as possible for the end user so they continuously come back for more services and we make it as enjoyable as possible. Now I'll transfer it to Amy.
Thank you, Darren. So yeah, what Darren was just talking about, it's really important with making sure that you have a holistic view of your data integration. And the example that he shared resonated with me because it kind of switches gears in healthcare to the patient experience, if you will. Because what we're talking about today is easing the burden on employees and making it easier for employees to get whatever administrative work done and getting back to the bedside with their patients. But there's this flip side of the whole industry that's really difficult for patients to have a seamless experience with Office A versus Office B. And that's where maybe, integrating more data could help improve that patient experience. And I guarantee you that's going to be another topic for one of our other healthcare webinars coming forward. All right, we're going to talk now about using AI. Everyone likes to talk about AI. Synoptic has an AI Center of Excellence that reports directly into our CEO. It's our think tank of responsible and ethical use of AI to improve productivity and gain efficiency in managed services. One of the products that we have in development aims to address the issue of healthcare employee burnout by reducing the manual administrative task of building healthcare worker schedules. The idea is to take the standard inputs that go into the schedule process, staff seniority, preferences, contracted hours, time off requests, and also the department and shift needs, who needs to be working at these given times, to generate an optimal schedule in a fraction of the time it takes to manually do so. We are currently working with healthcare organizations to pilot the SANES process, prove out its utility, and assess interoperability with other scheduling tools. One of the ways that we would like to engage with those of you that have joined this webinar is to offer a 1-hour discovery session to understand ways we can leverage technology and AI to reduce the burden and improve efficiency on your healthcare employees. We are about to set up a poll here where you can indicate interest of interacting with our team to reach out to you directly for follow-up. This can be anything from enhancing or uplifting your current data warehouse environment, recommendations on cloud migration and infrastructure, or to see if SANES AI scheduling might help you. So I see that the poll is up.
Thank you, Amy. As you're filling out that poll, thank you so much. And I want to talk about and invite you to our next webinar in July. So July 23rd, we're having a webinar, Modernizing Your MarTech Stack to Drive Engagement, Growth, and Customer Satisfaction. You can use the QR code here to register, or you can also find it on our website under events and webinars. We're looking forward to seeing you and your colleagues there. I'd like to now open it up to questions. So please drop your questions into the Q&A or continue dropping them into the Q&A piece. I do see we do have a few questions here, and we'll get started with that. So thank you so much for filling that box. Our first question is, what are the architecture components for data warehouse on Azure?
Alex, I can take that.
Mm-hmm.
So this particular data warehouse platform is onto that of Microsoft Azure Cloud. And the components are the data warehouse component, Azure Synapse. The ETL tool being used is Azure Data Factory, as well as the Power BI, which is available to the nonprofit at a subscribed rate, is being used for the end users. Alongside that, there are standard components for that of CI/CD, as well as the Key Vault, and some sort of area for the research team to directly access an Azure SQL database. So a full-blown multiple components putting together, building this data platform.
Perfect. Thank you. We have another question here. How is patient data taken care of in terms of HIPAA compliance and security?
That's a good one. This is first and the foremost for any of the healthcare organization. The first golden rule is, of course, to only take the data which is required for the reporting or the analytics into the data warehouse. On top of it, there is the data encryption and masking, which is being implemented on the data while in flight, as well as on the rest, to ensure that PHI data is being masked and encrypted.
Just to add to that too, from architectural standpoint, we will set up, they used to be VLANs, they'll call them VNets, they'll segment all that data. So when you're looking at how you're going to classify it. Does it pertain to PCI, PII, PHI, etc.? Then normally when the auditor goes through, make sure that all that data is segmented. It's easy then to generate a report and stay within compliance. So that's part of that overall kind of architecture discussion and solutioning up front that we'll walk clients through.
Thanks. We have another one here. Let's see, what is the Saints tool built on?
I can take that one. It's built on Azure OpenAI, so generative AI tool.
Okay. Let's see. Okay, so one's come in. What average monthly infrastructure cost for, what is the average monthly infrastructure cost for this architecture?
Ooh, Shell.
I can take that up. So it depends upon the environment, but with an ongoing managed service, it's always advisable with so many enhancements to have multiple environments, which is to say the development, the QA, and the production environment. With this, roughly around, it could be around 7 to 8K of expense that would be there across various components. And this can be further reviewed based on the refreshes that we would want to have. Usually during the off-business hours, there is a potential to reduce the cost by pausing some of the components.
It's just going to depend on the size of the volume or the volume of data. So it's going to pay per gigabyte, and then depending on what tier type medium we're going to put it on. But typically it's just going to be price per gig, and you can't get around the storage. If you have instances, say in development, you could run those 8 to 5 and then shut them off. You wouldn't pay for the CPU and RAM for those instances to minimize costs. So it just depends on your staff and where they are and how active those environments are.
We have another question on Saints. Did you want to continue on that one?
Oh, no, I was going to say, I hate to say it, but it just depends on the overall requirements. And the one good thing I would say with one of the public cloud providers is it's a fully integrated platform. So if you do, you wanted to add Azure Cognitive Services, AI, etc., it's really a click of a button versus, having something on-prem and building it out. So it's all integrated for you to test and trial those new services they bring to market, on a monthly basis.
Okay. We have another question around Saints. So how customizable is Saints?
Saints is, in order for it to work the way it's supposed to work, we need to be able to configure the inputs because it is a set of input files that will then, based on the contingencies for the given department, the optimal schedule will be generated. So the first thing that we would have to do is understand for the department that we're working with, what are the key things that go into the scheduling process, and then develop and standardize those input files, and then run through the AI engine to see how much time we can save. So it is customizable based on need.
Let's see. Okay, here's one. What are the key considerations for migrating healthcare data to the cloud?
I can take that one. Typically, we take the same approach that we would with any migration, but with healthcare, we want to be a little extra sensitive that there's a smooth transition from a compliance standpoint, similar to the ones, PHI, PII, etc. So it all takes place in the planning phase. So you want to be able to look at all of the workloads, do the proper planning, and make sure that cutover, minimizes any downtime and that the data integrity is maintained.
Okay. Let's look here. And you're welcome to continue dropping questions in the Q&A section if you do have any. Looks like we have one more. All right. How can cloud security solutions protect sensitive healthcare data?
We talked about this a little bit part of the webinar, but some of the key, considerations need to be around encryption. So if you can encrypt the drives, the data, etc., that adds another layer of protection, and then have decryption keys, access controls, so privileged access, threat detection and response, compliance monitoring. You always want to make sure that you're constantly monitoring towards those overall compliance requirements, and then make sure that you have a strong backup and recovery strategy. Right now, a lot of the auto industry, the dealerships are like 20,000 around the country that are being held for ransomware right now. So if you can't recover that data, you're probably going to have to cut a check. So if you can recover and not worry about it, they lose all the leverage as a part of that ransomware. So that I would just make sure that you have a strong strategy and plan in place.
See. All right, that looks like no, no more questions as of right now. We thank you so much for giving us some questions. And then I'm going to just play our video one more time here for our Saints video. Right. So with that, I want to thank all of you for joining us today for our session on Data Delight, Empowering Healthcare Employees with Managed Technology. We explored real-world examples of harnessing the power of data and technology to revolutionize the healthcare experience, while showcasing how managed technology solutions can empower frontline employees with the right tools and technology for improving patient outcomes. If you'd like to continue the conversation or are interested in taking advantage of the complimentary discovery session that's listed, I've also had it on the screen here with the QR code. You still have the opportunity, so go ahead and complete that form and we'll connect with you directly. We love to hear from you. Lastly, be sure to keep an eye out in your inbox for a follow-up email and resources related to today's session. And until next time, take care and have a wonderful day.
Thanks for joining, everyone.